Hi Team Run, Physio Megan here. So today I'm going to talk to you a little bit about a condition called Morton's Neuroma. Now, Morton's Neuroma is a condition of the forefoot and it tends to bring on symptoms such as pins and needles, pain, numbness, tingling, and often people will describe it feels like they're walking on a pebble or walking on a marble. Now, Morton's neuroma occurs in 5 times as many women as it does men, and it tends to happen in the latter stages of our life. Now, the most common place to experience Morton's neuroma is between the 3rd and 4th metatarsal heads. So if you go to your 3rd and 4th toe and where your toe attaches to your foot, roughly around there. Now, there are a few theories as to why Morton's neuroma occurs. One of them is that we think it's a series of microtraumas. So the nerve becomes gradually irritated from the metatarsal's head. The second theory is that the nerve and a ligament in the foot become entrapped, causing compression and inflammation. A third theory is that it could be bursitis. So bursas are a little sac of fluid and they're designed to reduce friction in the body. They're all over the body, but these bursas can become inflamed and irritated. And there is a theory that this inflammation then inflames the surrounding neural structures. And the fourth theory is that it's vascular in nature. So we get a reduction in the vascular supply around that area. The nerve then thickens. Because the nerve is thicker, it has less space and becomes irritated. So there's a few theories, but the most common one is this microtrauma. That's one that tends to be the most believed. So how do we treat it if we get it? Now, the great thing about Morton's neuroma is that people do tend to do very well conservatively. So the first thing we will look at is footwear. Have you got really narrow footwear? Can we widen that toe box up and that foot box up at all? Do we need to loosen the shoe? Would an orthotic be appropriate for you? Or could we just put some padding in and around the forefoot until we settle down any irritation of that nerve? Other things that you could look at in conjunction with your G is anti-inflammatories, but also steroid injections could be something that really helps to reduce that pain and allows you to continue walking and running pain-free. There is surgical management for Morton's neuroma. There tends to be 2 different types of surgeries, but that's obviously all done in a case-by-case scenario. Now, if we don't think it's Morton's neuroma, what else could it be? There are things that we want to rule out. We would want to rule out a stress fracture. We would want to rule out any kind of lumps and bumps to make sure that it's not a ganglion cyst, and we don't think there's any malignancies there, any tumours or anything like that. Also, pain in the foot. As we're getting older, we want to maybe consider osteoarthritis as an option as well, but also looking at any other deformities of the foot, such as hammer toe. So Morton's neuroma is a condition that I think lots of us have heard of, but it can be very irritating and very annoying because it kind of comes on a bit out of the blue and we get all these funny symptoms, but it can be managed conservatively. So I would suggest that if you have Morton's neuroma, you speak to a physio who might be able to diagnose from that for you and rule out other stuff. But another great person to see would be an experienced podiatrist because they specialise in all things lower limb and especially around those feet. I hope you found that helpful, guys. As always, any questions, drop a comment below. But other than that, happy running.